You've seen it everywhere, right? Ozempic. It is all over social media, it's in the headlines. People are calling it everything from a miracle weight loss drug to Hollywood's biggest secret. The buzz around it is just undeniable. But let's be real, with that much hype comes a ton of confusion and, frankly, a lot of misinformation. So in this explainer, we're going to cut right through all that noise. We're getting straight to the medical facts from official sources to break down what this drug really is, how it actually works, and what you absolutely need to know.
Welcome to MetaRhythm. We know the public interest in Ozempic is just off the charts. That's exactly why we've done a deep dive, carefully researching this topic using only trusted medical sources, like the FDA and the European Medicines Agency, to bring you a clear, science-based breakdown. And hey, if you appreciate clear, no-hype health information, please take a quick second to like this video and subscribe to MetaRhythm. Your support is seriously what helps us create more high-quality educational content just like this. All right, here's our game plan. First, we'll cover what Ozempic actually is. Then, we'll explore how it works in the body. We'll separate the real facts from the hype on that weight loss effect. And then, super critically, we'll cover the risks, the side effects, and some very important safety warnings. So, let's get started. Okay, so first things first, what is Ozempic? Before we can even start to unpack the headlines, we have to establish a factual baseline for what this medication was originally designed to do. The active ingredient, the real workhorse in Ozempic, is a molecule called semaglutide. Now, this isn't something you can just grab off the shelf. It's a prescription-only medication, and it's given as a once-weekly injection, usually just under the skin of your stomach, thigh, or upper arm. So let's look at its official purpose, because this is where the story gets really interesting. The FDA has approved Ozempic for adults with type 2 diabetes to do three things: improve blood sugar, reduce the risk of major cardiovascular events like a heart attack or stroke, and reduce the risk of kidney disease getting worse. But notice what's not on that official list: general weight loss. And this slide, which is taken directly from the official prescribing information, really drives that point home. See that key phrase? It's for adults with type 2 diabetes to be used along with diet and exercise. This is its core approved medical job. Okay, so if it's a diabetes drug, how in the world does it actually work? This is where we get into the science. And honestly, understanding this part is the key to understanding all of its effects, both the intended ones and the ones making all the headlines. Ozempic is what's known as a GLP-1's receptor agonist. Now that sounds pretty complex, but the idea is actually simple. Your body has a natural hormone called GLP-1. Think of it like a key that fits into specific locks or receptors to regulate your blood sugar and your appetite. Ozempic is basically a master copy of that key. And this master key does three crucial things all at once. First, it goes to the brain and turns the lock that tells you you're not hungry. Second, it signals the pancreas to release insulin, but, and this part is brilliant, only when your blood sugar is high. And third, it slows down how fast your stomach empties. It's this powerful 3-in-1 action that makes it so effective for diabetes, and, as we're about to see, it's the direct cause of its most famous side effect. And that brings us right to the weight loss effect. This isn't some kind of magic, unexplained thing happening. It's a direct result of the biology we just covered. So let's connect those dots. It's really a simple, logical outcome. Your brain is getting a strong signal that says, I'm full, and at the same time, your stomach is physically staying full for longer. The natural result of that, you feel less hungry, you eat less, and that calorie deficit very often leads to weight loss. It's a physiological effect, not a magic trick. But this right here is a critical distinction to understand. The drug maker markets the exact same molecule, semaglutide, under two different brand names. Ozempic, in its specific doses, is the one approved for type 2 diabetes. WEGOVY, which actually contains a higher dose of semaglutide, is the brand that's specifically studied and FDA approved for chronic weight management. This isn't just marketing, it's a crucial regulatory difference.
All right, now we have reached what is arguably the most important part of this entire explainer. Any powerful medication comes with potential risks, and it is absolutely essential to understand the full picture.
So, according to the official medication guides, the most common side effects are all about your gut. We're talking nausea, vomiting, diarrhea, and stomach pain. But there is another list you have to be aware of: potential serious side effects. These include things like pancreatitis, which is a painful inflammation of the pancreas, gallbladder problems, and even acute kidney injury. And this is absolutely crucial.
Ozempic carries what's called a boxed warning from the FDA. That is the most serious warning they can issue. It's designed to be an immediate red flag for doctors and for patients. It's there because of a potential risk of a specific type of thyroid tumor. Now, this was seen in animal studies and isn't confirmed in humans, but the potential risk is considered serious enough for this high-level alert. So, given those serious risks, this brings us to our final section on safety. There are specific groups of people for whom this medication isn't just risky, it is strictly advised against. The takeaway here is unambiguous. This medication is not for everyone. For some people, its use is considered outright dangerous. The medical term is contraindicated, which means it should not be used. Period. And this slide spells it out directly from the source. You should not use Ozempic if you or a family member has ever had a very specific, rare type of thyroid cancer called medullary thyroid carcinoma, or MTC. It's also off limits if you have a rare genetic condition called multiple endocrine neoplasm syndrome type 2. These are absolute do not use conditions. So let's bring this all together. Ozempic is clearly a powerful and effective tool for its approved uses in type 2 diabetes. But like any powerful tool, its significant benefits must be carefully weighed against very real risks. And that calculation can only happen in a conversation with a qualified healthcare professional who knows your medical history.
Which brings us to our final, vital point. This explainer is for educational purposes only. It is not, and it should never be taken as medical advice. Please, for any decisions related to your health, always consult with your own doctor or another qualified healthcare professional.
And that leaves us with a final thought to consider. We've seen how a drug made for diabetes has become a global phenomenon, completely changing the conversation around weight and health. Now that you're armed with the facts, what does the rise of these powerful GLP-1 drugs really mean for the future of how we treat metabolic disease? If you found this fact-based explainer helpful, please hit that like button and share it with someone who might find it useful. And let us know in the comments what you think and what complex medical topics you want us to break down next. Thanks for joining us at MetaRhythm.